In the still of the night, Jhuma Sardar was asleep when a kite slithered into her home. The snake's bite was quick, the help was not. Jhuma died before sunrise as the delay in arranging transportation and reaching Calcutta's Canning Government Hospital turned fatal. Jhuma's death is not an isolated story but reflects the hidden toll of snake bites in Bengal. In West Bengal, snake bites claim hundreds of lives every year, but most of them vanish in paperwork, never counted, never acknowledged. In response to an RTI application filed by herpetologist Subhrajyoti Chatterjee, snakebite death numbers appear divorced from ground reality. Across the 27 districts in Bengal, if one looks at the number in South 24 Parganas, for the last 3 years, snakebite deaths stand at 3, 4, and 13 respectively.
This is very different from what we are witnessing on the ground. In fact, each monsoon, there are many snakebite incidents.
Concurring with Chatterjee on the number of reported snakebite deaths, Rupa Sardar, Panchayat Secretary of Kultali, says that with fewer ambulances and doctors, remote villages like in the Sundarbans, surrounded by water and forests, are the worst affected. Most victims are forced to turn to quacks.
The trouble with snakes is constant here. People would often go to local healers and quacks, which led to deaths. Awareness has increased, and that has helped reduce deaths. But in the remote villages surrounded by rivers, fatalities still occur.
The official data from the Ministry of Statistics and Program Implementation 2021 to 2022 shows 0 snakebite cases and deaths in Bengal, citing unavailability of data. But records accessed by the Telegraph Online shows at least 100 cases at Canning Hospital alone between January 2022 to December 2022. Of those cases, there have been some deaths too. A response to an RTI application by Subhrajyoti Chatterjee shows up 2,240 cases in South 24 Parganas, including 3 deaths. This discrepancy is not just a Bengal problem. The MSPI data shows UP to have 36 snakebite deaths in 2022, but the response to Chatterjee's RTI application shows 0 deaths. Even Kerala, a high-prevalence snakebite death region, reported 0 cases and deaths in official statistics. Delhi, Ladakh, and Lakshadweep are the other regions with 0 against their names. But experts estimate over 58,000 Indians die from snake bites every year in India. Hospital records often do not label snakebite deaths as such.
This number breached the divide between the actual snakebite deaths and the official data, and people had a sense of the magnitude of the problem. Researchers used a method of verbal autopsies, essentially asking family members about the reason of death, and found discrepancy with the deaths recorded at hospitals.
In the ADSI data published by NCRB, snake bites are often marked under poisoning or sudden death, leading to severe reduction in numbers.
Though patients enter hospitals with suspected snake bites, there are cases where the post-mortem report does not say the cause of death is snake bite, but it could be something else. Often it labels it as poisoning or kidney failure.
The ADSI data that capture snakebite deaths under poisoning record a far bigger number. The West Bengal RTI data obtained by Chatterjee and this divergence bring forth profound ways in which flawed data collection shapes public perception and policy. Bijan Bhattacharya from Canning Hospital suggests that the issue goes beyond just medical research. He highlights flaws in the very first line of defense.
Around 2015-16, there was a sudden theory that the antivenom serum was ineffective against Russell's viper in Bengal. This theory became a tool for some doctors to deflect blame for deaths.
Patients often reach doctors after the golden hour, the critical window of about 3 to 6 hours within which an antivenom serum is most effective.
Basic tests take time. The kidney gets damaged by then. Also, I have seen through helpline calls how dialysis for snakebite victims is not a priority and gets delayed. In short, the first line of medical response is weak.
Simply put, a snakebite patient in a remote part of West Bengal is on an uphill climb to survive after being bitten. In Bengal, the earliest stories of snakebites are found in the 13th century Manas Mangal Kavya. Back then, divine intervention saved lives. But today, we need something else. Better data, faster treatment, awareness on a war footing to combat the hidden toll of snakebites in Bengal.